Hello and welcome to Coronavirus Impact. I'm Francine Schertzer. Our first guest today on the phone is Katie Meyer, reporter for WHYY. Katie, thanks for joining us.
Thanks for having me.
Now, last night, Governor Wolf announced the closure of all non-life sustaining businesses. Let's take a look at his announcement.
I have heard from business owners and workers that they are worried about the financial repercussions of a closure. I'm aware of that, and my administration is already working every channel to find ways to support businesses and workers. But before we can save livelihoods, we must save lives. And so I will be working with local officials, permitting authorities, and others to enforce mandatory closures.
What happens to businesses that don't comply with the governor's order?
So far, there's been a little bit of back and forth about what enforcement might look like. And I don't know if we have a really good picture of it yet. I think for now, the administration is really hoping that businesses comply. But I believe they do have, the wherewithal to enforce, if it comes to that. Other countries like Italy, they've started levying fines, for instance, on people who break sort of curfews, that kind of thing. Other states have said they're going to send out cops to, shut down restaurants or urge restaurants to shut down if they haven't already. So I think we'd be looking at some stuff like that. But again, the administration has been really sort of focusing on making sure people do this voluntarily.
What kind of reaction is the governor's order receiving?
I think people are worried anytime you see a big interruption like this in the way normal life goes. People are going to, you really notice that. And I think that's where really fear comes in. There's also been a lot of confusion about what specifically qualifies as life-sustaining. Like, for instance, what I'm looking into right now is there was a category that was deemed non-life-sustaining laundry services, and that included laundromats. And people who don't have laundry in their houses, in their apartments, especially people in cities, saw that and they were like, what the heck am I going to do, wash my clothes in the bathtub? And so I've been talking with the Wolf administration and with some others about this, and it looks like they're going to reverse course on that one. So they're really soliciting community feedback on, what's possible, what's not. And it seems like there is some flexibility here, but I do think there is also confusion about what is covered under some of these categories.
Now, you've recently relocated and taken a position with WHYY in Philadelphia. What's it like covering the pandemic from one of the most affected regions in the state?
Well, it's a lot of me staying in my apartment, I'll tell you that much. I think it's, I've been here since the weekend of March 9th now, so a little bit more than a week I've lived here. And it is a stark difference looking at, how bustling the city is. And then when I ventured out yesterday to get groceries, it's just dead. It's so quiet here right now. And so I do think, that's a testament to people taking these orders seriously, taking the pandemic seriously. But there is also a feeling here that, we're going to see community spread of, COVID-19 if we have not already. And so I think people are really, preparing for that, just hunkering down, trying to stay as isolated as possible.
3 special elections were held earlier this week, including one in Bucks County. Can you talk about the reaction that has come from the fact that these special elections went ahead in the midst of this pandemic?
Yeah, people were really worried about that. I think especially county officials, especially Democrats, were really, really pushing to have that election postponed. You had, the county commissioners file suit the night before the election in an attempt to get, a judge to issue an injunction to postpone it. That did not work. The judge overruled it, said there was no case law that would support doing that. And so, the election went forward, and the Republican did win. Casey Tomlinson beat Howie Hayes in that contest. Democrats were, I think, extra upset about the outcome. They said, the election should not have been held. There was confusion about whether people should go out. It sort of was contradictory, given the governor's orders to stay inside, a recommendation at that point to stay inside. And nevertheless, people did go out. Turnout was pretty high. I think it was like 20% of registered voters, which is actually pretty good for a special election. So, I think there was a lot of concern about especially elderly people going to the polls, being around others. The polls that I went to in Bucks County, they didn't have big lines, so it wasn't terribly difficult to keep your distance. But again, anytime you have a lot of people in one place, especially elderly people, you are at higher risk for contracting the virus. So, yeah, I think people were worried.
Is there any anticipation that the presence of coronavirus could impact the scheduled state primary election on April 28th?
That's something we're all looking at. So far, no news on it. I think, again, we've seen Republicans be pretty reticent about moving those. House Speaker Mike Terza, for instance, he was the one who had control in the special elections. Now, that won't be the case for the actual primaries, but Governor Wolf has not said one way or another where he's leaning on it.
You recently wrote about potential layoffs at the Philadelphia airport. Can you talk a little bit about how the presence of the virus is affecting the state from an economic standpoint?
Yeah. I mean, so those layoffs at the airport, that's thousands of workers, and many have already been laid off, and it's going to continue through the weekend. Listen, this is devastating for workers. A lot of, for instance, tipped workers, service workers are totally out of a job. Restaurants, bars, things like that operate on pretty slim margins. So it's not like the people who own these places have like a ton of like slush funds to keep paying people while they're out of work in many cases. So, yeah, people are really just, they're facing a huge loss of income. And now we've seen states that have started to take pretty specific and drastic measures. Like, for instance, New York State has stopped collecting on student debts and other debts. And so that's, again, the kind of measure that we may see more frequently as this stretches on and people are still out of work. But I think it can't be overstated how long this is going to reverberate. Specifically the people I was talking to in the airport, they were told it's, a contract situation. So it's mostly subcontracted workers that work for, companies that contract in the airport, not the airport itself, who got laid off. And they were told by their bosses at these, contract jobs that they might be looking at, July, August before they can get back to work. Of course, nobody knows for sure, but that's a huge loss, especially for tipped workers, especially in airports where people fly more in the summer. That's the good season. So, we don't know how long it's going to last, and we cannot underestimate how profound of a financial impact this is going to have, especially on service workers, but on many others as well.
What kind of assistance is currently available for people who may have perhaps either been recently laid off or forced to close their businesses?
So they can apply for unemployment. That's really, people have started doing that in droves. The last number I got from the Department of Labor and Industry was on Wednesday, so it's out of date now. But I know that 60, 70,000 people were applying for unemployment just, this week alone. It's gone up an enormous amount. So that is going to continue to be an option. The Wolf administration says even if your hours were just cut back, you can still apply for unemployment. In terms of specific fixes, the legislature is mulling some stuff, but nothing has passed yet. I think everybody's waiting to see if there's going to be federal help that comes in, because that has been promised, including the prospect of maybe, checks to individual people. It just, again, in terms of specific changes, the Department of Labor and Industry, they did waive 2 of the requirements for people who apply for unemployment compensation. Usually they have to prove that they've applied for or searched for new jobs, but that's no longer the case. They can just apply, regardless. And they also, they don't have to wait a week before benefits kick in. It can kick in immediately now, which is usually not the case. So we're starting to see these changes being made to help people a little bit more, but I think we're going to see a lot more legislative change from the state level and also from the federal level.
Do you foresee this economic uncertainty affecting areas like state pensions or perhaps the way the state budget is crafted in the coming months?
Yeah, that's a great question. I can't imagine that it won't have an impact. We're seeing a pretty profound economic downturn right now, and I think as everybody is aware. So, listen, when revenues don't come in, this is just for the state budget, when revenues don't come in as expected, they have to fill holes in lots of different ways. And we have a Republican-controlled legislature. They don't usually want to raise taxes. So they're left to kind of just patchwork it together. That's been my experience watching them do it in years past, and I think there's no sign that that's going to stop. So if it's a tough budget year, and it seems more and more likely that it might be, then yeah, I mean, we're gonna see some really creative math, I think.
Katie Meyer, political reporter with WHYY in Philadelphia. Thank you for talking with us.
Thank you.
Stay tuned. We will be back right after this short break.
How did that become law?
Does the governor get to decide everything?
Why was that person elected?
PCN wanted to help answer these questions by creating Civics 101, a free online educational tool to teach Pennsylvania students how the state government works. Stream video interviews with elected officials, tour the state capitol and governor's residence, and so much more. Go to PCNTV.com to start learning today. PCN Civics 101.
Welcome back. Our next guest on the phone is State Representative Kathy Rapp, a Republican representing Warren, Crawford, and Forest counties. Representative, thanks for being with us today.
Thank you for having me.
Yesterday, the governor ordered the closure of all non-life sustaining businesses. What did you think of his actions?
I myself, as well as many others, probably have very mixed feelings. There are a lot of businesses that are in the supply chain. Certainly, companies, what I am seeing, I can actually speak to my district, businesses who are actually manufacturing, shall we say, components for truck parts or anything like that, or plastics for medical equipment. It is some of these products that are being manufactured are in the supply chain for a final product that is life essential. So there are concerns there. I think I know that our leadership has been in contact with the governor's office. Certainly, many of the businesses here in the 65th Legislative District, if they are government contractors and they are not on that list, they are already being advised to contact the Secretary of Labor and Industry for a waiver to continue manufacturing. So as far as the governor's press release yesterday, we did have a phone conference with our leader today, but the governor's website is down. The Department of Health website is down. I just checked before coming on the air. So I think there's mixed feelings. I think we all understand that we are in the middle of a health crisis with this virus. I've been in tune when the president comes on and talks about all of the implications from the federal level, the assistance that's out there. But we want to make sure that anybody is manufacturing a product that's in a supply chain that for an essential business, especially in the health realm, or delivery of products to our groceries and our stores, those manufacturers, it is critical that they continue.
Did the governor have the authority to make the call that he did yesterday to close these entities?
That is debatable. So I am not an attorney, so I will leave that up to the attorneys to figure that out.
Can you explain?
I did just go ahead.
I'm sorry. Go ahead, please.
I did just get notified that as of today, we do have 83 new cases, so that brings Pennsylvania up to a total of 268 as a total. I do not have the breakdown as of yet as to what counties those cases are from.
Can you explain to our viewers the actions that the House took earlier this week to allow that body to function remotely during this pandemic?
We had a session this past week on Monday. What happened was the only action that we took as part of that session was to pass a rule. The House does abide by a set of rules, as well as the Senate. The Senate followed our lead in passing new rules that would allow us to conduct session off of the House floor by either voting from our district offices or in our office in Harrisburg at a remote site.
At a time that there's been some concern about lack of rural broadband when people are trying to work and communicate remotely, has this been an issue or a concern for your constituents?
It's been an issue, I think, more for our school districts in rural Pennsylvania. Certainly, even in the 65th, we have many students that do cyber charter. Those students can continue their education, K through 12. A lot of our college students, university students that are home right now, many of them are continuing their education through cyber schooling. However, there is still a great need for more broadband access in rural Pennsylvania. There's no doubt about it. Several of my schools, the schools themselves have internet service, but not all students have that service in their homes, which will limit our children in rural Pennsylvania, their educational access due to the lack of broadband. It's something that our county is looking at as far as grant money and providers to be able to lay that fiber or put up a new technology to provide that broadband. But unfortunately, right now, it does not exist to the extent that we need it. And that goes as well with, it even includes, people who need forms from the government. I have a lot of constituents who do not have, they don't even have a computer in their home, and some of them don't even have a smartphone. So we are looking at closing walk-in traffic in my offices for next week. So that will limit people even more. However, they will be able to stay in touch through phones and my webpage, emails, and Facebook. But yes, broadband is definitely a barrier, and also a barrier for telemedicine.
Since you brought up the issue of telemedicine, you chair the House Health Committee. Can you talk about any potential legislative proposals, perhaps including telemedicine, that might be offered or moving in the coming weeks as the legislature attempts to deal with some of the problems and repercussions that have occurred as a result of this outbreak?
Senator Vogel's telemedicine bill passed in the Senate, and it did pass the House. I believe it went through the Insurance Committee. I'm not sure which committee it went through. And then it did pass the House, and it is currently back in the Senate. And that bill would allow and would provide for more insurance coverage for telemedicine. So that bill is out there. We don't have any pending legislation for more telemedicine. We're waiting to see what happens to that bill that's sitting in the Senate.
One last question. Do you have any insight as to when the House will return to a voting session?
On our call today, it is hopeful that we can return next week. However, we're waiting anxiously to see what unfolds today. But our plans are to reconvene on Monday and Tuesday. I know there are some educational bills that are being looked at as far as waiving the number of attendance days, the testing. I think that legislation still has to go through committee, brought up for a vote both in the Senate and the House. I think some relief also for small businesses. I don't have anything currently in the Health Committee. I think our Department of Health is doing a good job. We all know there are issues from the federal level to the state level as far as the masks, some other materials that are needed, including ventilators and other supplies. It was good news to hear that there is a possible drug, the malaria drug, that can be prescribed for people who contact the virus. And I know that there's also work on a vaccine. So that's basically where we are in the Health Committee. No real legislation because I think the Department of Health does have a pretty good handle. They're in constant communication with the counties, county government. Some counties have declared emergencies, but they're also working very closely at the federal level with the CDC and other organizations with Health and Human Services at the federal level to make sure that we're all working together in this situation for our state and our communities and our nation.
Unfortunately, that's all the time we have right now. Representative Kathy Rapp, thank you so much for joining us.
Thank you.
We'll be back right after this short break.
Take a nostalgic look back at some of the best games PCN has televised over the past 20 years with PCN Sports Classics. Watch the entire game without interruption and get updates on key players and coaches who have made Pennsylvania sports history. Watch new episodes monthly and stream the full series on demand with the PCN Select streaming service. Visit PCNTV.com to subscribe. PCN, proud to bring Pennsylvania sports to you.
Welcome back. Our final guest on the phone today is Jane Torregrossa, a licensed professional counselor at the Hershey Counseling Center. Welcome.
Thank you.
In addition to the physical concerns that are related with the COVID-19 virus, how do you see the impact that this could potentially have on someone's mental health?
Well, as you can imagine, the clients that have anxiety, their anxiety has been increased. Those with depression, just another thing to be depressed about. So it's certainly affecting, I think, everyone, and then anyone certainly with these, symptoms of anxiety and depression, it certainly can make it worse.
If people are forced to stay home and they have a lot of free time on their hands, how can that be problematic?
Well, it can be both problematic and it can be beneficial to some. But the people are certainly that like structure, they like to get out, they like to be with people, that those people are very much struggling with being isolated, being, confined to home, being restricted. So we definitely encourage them to be creative, find new ways to find structure while you're at home and to do things that maybe they never had time to do before. So they have a choice to be either, frustrated and anxious, or they can try to turn it into a positive.
What kind of advice would you offer to help people to stay calm?
So I think self-talk is number one. Certainly what we say to ourselves makes a huge difference if we're worried and scared and focused on our fears versus saying, it's going to be okay, we can get through this. And to remind ourselves that we adapt. It's in our DNA to adapt. We wouldn't be here as a human species. So we all have the ability to adapt. So, it is a challenge. And I think if we view it as a challenge versus fearful and out of control and start focusing on what is in our control, which there's quite a bit actually that's in our control, which one makes you feel better? It definitely feels better to focus on what's in your control.
What advice would you give parents in terms of how to talk to their children who may be scared because of the sudden disruption in their lives?
Right. So that's difficult. The children certainly are out of sorts with all of this. It's new for everyone. So I think explaining to children that things like this have happened before, well, maybe not exactly this, but, it's unusual, but we're in it together and it'll be okay. I think reassuring the children that it's temporary, and it is. It's temporary.
Are there common behaviors or warning signs that we should look for to indicate that a loved one may be suffering from anxiety during this time?
Sure. Certainly the inability to focus, constantly worrying, and then certainly the physical symptoms if they start shaking, heart racing, being beginnings of a panic attack. The number one thing you can do truly to prevent a panic attack is to, take like slow, deep breaths and do the relaxation breathing, and very much as well as very important is what you say to yourself, to say, it's okay, I know what this is, I'm just feeling a little bit of anxiety, a little bit of anxiousness, but it's okay. It's okay is a huge phrase to be saying right now. Telling your brain you don't need to panic. There's no, it's okay. We'll get through this.
What resources are available if someone is suffering from anxiety or depression, particularly at this time?
Well, at this time, obviously, with things closing, I think the important thing to do is try to get in with a therapist for mental health. We are open. We are doing a lot of virtual now. So I think they can call in and have access to the virtual behavioral health. So it's important to speak to someone if they feel like they're really, getting very anxious or very depressed.
Jane Torek-Rosa, thank you very much for joining us today.
You're welcome. Thank you.
That's it for today's show. Coronavirus Impact airs on weekdays at noon and 8 p.m. It's also available on PCN's Facebook, YouTube channel, and on our website, pcntv.com. I'm Francine Schertzer. Thank you for watching.